Hello, good evening, everybody. Welcome to our Tech Tuesday. Thanks to those who joined us last week for the health seminar, and I plan to run a couple more of them along the line at some stage, because I do believe that it's a good thing to share that information with as many people as possible. And I know overseas they're doing regular meetings like that and just inviting all different guests to come on. So maybe it's something to look at over here as well, but maybe not quite as often as every week. However, we are getting going with a new series this evening, and we're talking about heart health specifically. I know we've gone through the Heart Awareness Month in February and everything else, but our heart is our body, and it's probably the most important part because, well, it's a bit of a combination between the heart and the brain. Because without either one of them, we will not be in a very good place. And I know they can do heart transplants. I haven't heard about brain transplants yet, unfortunately, in some cases. However, we do still need our hearts. And without the heart, which is your main pump to get the blood supply around you, our bodies end up in a rather sad state, as I said, because the heart is the thing that starts to beat at about, I think it's about 2 months, between 1 and 2 months post-conception, and keeps beating until the day we take our last breath. And that is one amazing little muscle, because your heart is a muscle and it beats, I don't even remember the stats, a good few thousand times a day, and keeps us going 24/7, literally from, as I said, about 2 months post-conception to the day that we die. So not even from birth, but long before then, it keeps going. So I'm going to touch on some basic heart information. And once again, fortunately, I get to borrow some of these presentations from various other universities. So please remember that the information I'm sharing over here is not always mine completely, but quite often borrowed from universities who fortunately know a whole lot more than me and very graciously share this information onto internet, which allows me to pick it up and borrow it. So most of this presentation is taken from the University of Arkansas, the Division of Agriculture, Research and Extension. So the question here is, heart disease, are you at risk? And I do believe that pretty much all of us are at risk some stage and in some way. Heart disease is the #1 killer of American women. Now, with this particular presentation, they seem to be focusing mostly on women, but we need to know that heart disease is also prevalent in men as well as women, and is pretty much the #1 killer in both types. Heart disease kills more women than all forms of cancer combined. So ladies who are worried about breast cancer or ovarian cancer or any other sorts of cancer, they should probably be more concerned about their heart than about the cancer. Heart disease can permanently damage your heart and your life. Because remember, we can live with our heart beating. It doesn't have to be beating optimal. We can live. It might not be a very happy life because you'll be very sedentary. You won't be able to move very far or very much without losing breath. And your body is probably going to swell up quite a bit. But you can survive on a damaged heart. But generally your lifespan is going to be severely reduced. If heart disease is not treated, serious complications can develop. Most women do not know that heart disease is their own greatest health risk. As I said, people tend to be so concerned about cancer and COVID and all these other funny things, but they forget that their heart is actually a greater health risk. And the sad part is that in a lot of cases, it is preventable. People can take action to protect their hearts. And heart disease is a now problem, not a then problem, not a in future problem. It's a problem now. Later may be too late. You can have a physical, you can be cleared of all problems and drop dead from a heart attack a little bit later, within a couple of hours or a couple of days, because it's known as the silent killer. And there are many forms of heart disease. Things like coronary artery disease or coronary heart disease is the most common one. And heart disease develops over years and progresses when the heart doesn't get enough nutrient-rich blood. One of the things is called arteriosclerosis. Don't worry about all these big fancy terms. You go to visit a cardiologist or your GP and they will throw some of these big fancy words at you, but don't stress too much about what they mean. And arteriosclerosis is a disease in which plaque builds up inside your arteries, limiting the flow of oxygen-rich blood to your organs. Remember, if the heart is not pumping, the blood is not flowing, and your blood is what carries all the nutrients and oxygen every single cell in your body. So that blood is not flowing around, your cells are dying. And this is what arteriosclerosis looks like. So you'll see, hopefully my little cursor will come up. This is a nice clean artery, normal artery. It's got a relatively thick wall and it's circular in shape, and the blood flows through in one direction. And then probably an arteriosclerotic artery will have this yellow stuff building up over there, and that is your plaque. Very similar to the plaque that builds up on your teeth. This is something that builds up in your artery. And if you can imagine, for those not using LDC in their drains, you rinse fatty food and fatty dishes and fatty pans down your drain. Some stage that drain clogs up. And that's because of all that fat that is clogging up the drain. And then suddenly you've got a blocked drain. If you're using LDC on a regular basis, you probably wouldn't have that problem. And we need to have a similar sort of thing in our arteries. Now, a heart attack occurs when blood flow to a section of heart muscle becomes blocked. Most often the result of coronary artery disease, because when that little piece of plaque breaks off and runs along and it blocks, that's where the problem comes about. If you've ever experienced a cramp in your leg, a heart attack is exactly the same thing. It is a cramp in the heart muscle, except it's a lot more fatal. And this is more or less what it would look like. So there's what your heart looks like. And you have this little embolus that comes along and it blocks up, and suddenly there's not sufficient blood going through your heart and it attacks you. And well, yes, we won't get into that one. However, there is good news. Heart disease can be prevented or controlled. And prevention includes things like lifestyle changes and sometimes medication prescribed by a qualified doctor. Young women, and we can say young men, need to take steps to protect their heart health now, since heart disease develops gradually and can start at a young age and can be triggered by certain supposedly childhood sicknesses, like rheumatoid arthritis or rheumatic fever and measles. All of those things, even flu, can lead to heart problems. The risk rises in women from between ages of 40 to 60, mostly because the estrogen levels drop during menopause, and many women develop one or more risk factors for heart disease during these years. Older women also need to take action against their risks, as it is never too late for women to protect their heart health. Now, the risk factors, we said there were a couple of different types of risk factors, both controllable as well as uncontrollable. But the controllable ones that you do have a full choice over how to handle them is things like smoking. The only time I smoke is if I'm on fire, so rather quit it. High blood pressure, often caused by stress and bad diet. High blood cholesterol and high triglycerides, again, a lot of it caused by stress and diet. Overweight and obesity, obviously definitely caused by diet over there, although there are certain illnesses that can contribute to overweight and obesity. It is most commonly your diet. Physical inactivity. Now that, in vast majority of cases, we all have control over. Obviously, there are cases like, paraplegics or quadriplegics who aren't as active as what they could be, but physical inactivity is a major contributor towards your heart health. Diabetes and prediabetes. Yes, there are some cases of diabetes that are out of your control, but if it's type 2, almost invariably that is diet related and very much in your control. Metabolic syndrome, and I need to cover this a little bit more in depth at some stage, and maybe that'll be the next part of the series, I'm not too sure. But metabolic syndrome is to do with your cholesterol, your blood pressure, and your heart condition. And that is altogether a bit of a problem. Now, some of the risk factors that you don't really have much control over. Family history of early heart disease. If you had a choice of which family you were born into, you could probably control it, but most of us didn't really have that choice. Age. And we try and stay as young as possible for as long as possible, but if you're 55 and older, for ladies and gentlemen as well, that's a risk factor. A history of preeclampsia during pregnancy. That, fortunately or unfortunately for men, is specifically aimed at women. And preeclampsia, I see quite a bit of it, and it's basically uncontrollable high blood pressure during pregnancy and is considered a medical emergency. So it's something that you've got to be aware of and be careful of. So if you are pregnant, please make sure that you know the signs of preeclampsia and discuss this with your gynecologist as early as possible in the pregnancy, because it is something that you don't really have much control over, but it can be controlled through medication. Other risk factors include things like sleep apnea. So if you're not sleeping well, you could be in trouble. Stress or depression. And those are something that are to a small extent in your control, in a larger extent, not really. Too much alcohol. Definitely a risk factor, definitely within your control. Birth control pills. This is quite a touchy subject, but particularly for women who are over the age of 35 and who smoke. Chat to your doctor who's prescribed your birth control pills and find out what alternatives and what risks there are. Anemia. And it seems that an awful lot of people are anemic these days. An unhealthy diet. Very big risk factor and very much in your control. Now, you also, in heart disease, have a thing called a multiplier effect. So one of the risk factors doubles your risk. Two risk factors quadruples your risk, and we're talking heart disease and heart attack. Three or more risk factors can increase your risk more than 10-fold. So go back and have a look at this presentation, have a look at what those risk factors are, and take note of where your risks are. In the medical field, as I tell my patients regularly, we generally are quite negative people, but we always look at risks. There's never a guarantee either way. There are literally walking miracles, according to medical science, of people who have got issues or have had injuries, and by all logical fact, they shouldn't be walking around pain-free, but they are. Or in other cases, they have an issue, they have an illness, or they've had an injury, which by all logical means that they should be dead, yet they survive and go on to thrive. So when we talk about these risk factors, it just means on a percentage scale, statistically speaking, your risk is higher or lower. So in my case, for instance, I do a lot of compression stockings, mostly on Caesar patients or hysterectomies. But if you're pregnant and have a Caesar, specifically an emergency Caesar, your risk for developing a blood clot is about 25% greater, statistically speaking. All that means is there's a 75% chance of you not having a problem. But because we look at the negative aspects, we take that into account and we take the precautions of doing stockings, etc., to lower that risk. By doing just 4 things, namely eating right, being physically active, not smoking, unless you're on fire, of course, and keeping a healthy weight, you can lower your risk of heart disease by as much as 82%. Just 4 things that are not expensive, do not take a lot of time, just take a little bit of focus. And in fact, by not smoking, you're saving yourself a small fortune. Talk to your doctor. Women and men should talk to their healthcare provider about what their risk for heart disease is. And do yourself a favor, always prepare a list of questions before a visit. Because you think of all these things, you're sitting in front of the TV over a cup of coffee or in bed and you're going, oh, I need to ask my doctor this and I need to ask my doctor that and you've got this list of 50 questions and you walk into his office, you sit down and he says, hi, how are you? And you say, I'm fine. And 49.5 of those questions have just gone out the window because you've forgotten everything that you wanted to ask. You walk out the door and the receptionist says next, and you go, oh, but I needed to ask him, but it's too late. So prepare a list. And trust me when I say this, with no disrespect to the doctors, but if you don't ask, they probably are not going to tell, because those of us in the medical field take a lot of things for granted. We assume that the things that we do or say on a daily basis are common knowledge to everybody. But we forget that you as the patient, this is new to you. And therefore, if you don't ask your doctor, he will almost definitely not tell you because he doesn't think about it himself. Write down what your healthcare provider says. In a consultation, don't be afraid to take notes. And somebody asked on a webinar recently about recording a consultation. And there's a few ethics questions about this. And the one is, should a consultation be recorded? Because remember, what gets said in a doctor's in a doctor's office is confidential and stays in that office. So the question came up was, can they record a session? And the answer is yes. With your permission, I, as the medical provider, can record the session because that safeguards both you and I. Because otherwise, should there be a problem, it's he said, she said, they said. But you also have the right to do a recording yourself and or take notes. Just like this presentation, when I sign off in the next few minutes, you probably will have forgotten 95% of what I've said. I know I will have. So we're recording this so that you can go back and check it out again. I have the advantage in that not only am I recording, but I also have the original PowerPoint, so I can go back and check my notes and remember what I've said. But when you're talking to your doctor, you don't always have the benefit of this recording. So take notes. Tell the healthcare provider about lifestyle behaviors, such as smoking or being physically inactive. And if you're in a small town, you probably know your healthcare provider to be sitting at the pub smoking with you in a lot of cases. However, if he doesn't know you that well, tell him. So the key tests that they do for the heart disease risk are things like blood pressure. Very simple. You can actually buy a blood pressure kit, a DIY one from a pharmacy or from online store or whatever, and take your own blood pressure on a regular basis. Your blood cholesterol, total HDL, LDL, and triglycerides. That obviously has to get done by a professional blood lab. Do that once every 3 to 6 months, depending on your risk factors. Fasting plasma glucose or diabetes test also needs to be performed either by your GP or by the local lab. Do it on every 6 months or every quarter if you want to, if you think your risk is high. Your BMI and waist circumference. And as we've covered just recently, BMI is becoming a little bit of a contentious issue and might not always be the best indicator. It is an indicator, pardon me, but might not always be the best indicator. Your waist circumference, however, now that is a very good indicator. And I spoke about this in a good few sessions, I think maybe even beginning of last year, about how your waist circumference and your heart health go together. An electrocardiogram, or what we all commonly know as an ECG. Again, maybe once a year, go to your GP and say, listen, I need a full physical, but a stress physical. And they will do all of these tests for you. The stress test is another one. If you're driving in peak hour traffic, you're probably having a stress test on a daily basis. However, you won't know if you've passed or failed until you get the correct testings done. And you can lower your heart risk or heart disease risk. Begin today, not tomorrow, today. Make changes one step at a time. If you're smoking a packet of 50 a day, tomorrow you're smoking a pack of 49, and then 48, and then 47, and then 45. And so you go. If you usually park in the disabled parking bay, tomorrow you're going to park 2 bays over and you're going to walk. Just those little things. If you haven't signed up for Parkrun yet, tomorrow you're going to go onto the Parkrun website and sign up and come and join somebody, one of the sessions on Saturday. You might not become the first, or we might not be the first person to come back, but you won't be the last person either, and you will enjoy it. Little things. And Parkrun, just by the way, is free. Don't smoke. If you are a smoker, ask your healthcare provider for help in quitting. Not only is there the simple way of cutting back 1 a day, but there's also things like patches. There's numerous different ways to help you to quit. And probably one of the most effective ways is to get a partner, an accountability partner, to help you. Be physically active. 2 hours and 30 minutes of moderate intensity aerobic activity each week. Not per day, each week. So divide 2.5 hours into 7 days and see, probably about 5 to 10, I would say about 10, 15 minutes per day of being physically active. Find a couple of stairs, walk up and down them rapidly. Go to your local mall, do a 100-meter stretch, walk it rapidly. Just get that aerobic activity going. Add strength training 2 to 3 times a week. So the next time that you go grocery shopping, don't go into your app and order. Go down to the shops, park as far away from the entrance as you can, walk along. Don't take your groceries back to your car in the trolley. Carry the bags. You've got your aerobic exercise, you've had your stress test done, and you've got your strength exercises done. All very simple to do. Follow a healthy eating plan. And if you feel that you can't do it on your own, do a Google search for a healthy eating plan. More specifically, speak to a registered dietitian or a clinical nutritionist, or even find an eating coach. There's a lot of them online these days. Find somebody to help you to develop a healthy eating plan that is low in saturated fat, trans fat, and cholesterol, and moderate in total fat. Limit your salt and your sodium. Remember, read labels on any processed foods you happen to be getting. Preferably aim for single ingredient, as in raw foods, and cook from scratch, because then you'll know how much sodium and salt is in your food. Limit your alcoholic beverages to no more than 1 a day or 2 for men. Not quite sure why men have to have more, but you know, there are these little differences. And if you do need to have something, stick to something like red wine, which is good for your heart, but only 1 glass a day. Choose a variety of whole grains, fruits and vegetables daily. Choose fish, poultry, and lean cuts of meat. In my personal case, I always aim for things like venison, because I know that that is a good source of meat. Your poultry, make sure it's free range, if at all possible, because it is a lot healthier. Your fish, not farm fish, but wild caught fish. Use non-fat or low-fat milk. I will sometimes disagree on that one, because personally I use full cream milk, but that's me. Use things like cheeses and yogurt, which are still your dairy, so you're still getting your calcium, etc., but it's slightly healthier than your so-called full cream milk. And maintain a healthy weight. That is your key. Manage your diabetes, your high blood pressure, and high blood cholesterol through living a healthy lifestyle, not a pharmaceutical lifestyle. Take medication if prescribed, but if you feel that you've been on it for too long, please question your doctor. Ask them, is it still necessary for me to take half the pharmacy on a daily basis? Or can we cut it down to 1 tablet, or at least a quarter of the pharmacy? Prevention begins with you. Not your doctor, not me, but with you. Take 1 step at a time. Replace unhealthy habits with healthier ones. So don't just stop cold turkey on anything. Very difficult. Eat for a healthy heart. Start walking. Try 10 minutes and add time gradually to reach your 2 hours and 30 minutes each week. So the 10-minute start that they talk about means 10 minutes per week. That is just over, just over a minute a day. Pretty sure anybody can do that. How to keep going? You need to view changes as a new lifestyle, not quick fixes. Set realistic goals, and this is where it's good to have an accountability partner or a coach. Buddy up. Don't worry about slipping up, because that happens to pretty much everybody. As long as you don't stay there, I always say, if you fall, don't stay there. Get up again. So get back on track. Reward your successes, not with a large chocolate cake either. maybe one little square of chocolate is okay. Be your own advocate. Ask questions and seek information. I'm going to stop there because we're going to get into the significance of the problem next week. We've still got about 5 minutes left. Stop sharing my screen for now. Does anybody have any questions or comments to make before I stop my recording?